Hey everybody, it's a Sunday afternoon and I'm in the Florida room. Uh, this is the chair I usually come out here and relax in. Um, I just kind of got my grubbies on today. I've worn this before. This is a tank top shirt, and I usually take this off to work out with my brick. My brick and my oil is right over there on the floor. And I'm sort of sitting on the north wall, and which is the exterior of our mobile home, and then directly behind the laptop is the back wall of the shed. Okay, this door over here, I open this door up in the morning, and about 8:30 to 9 o'clock or 8 o'clock, the sun comes up. That's the east wall of this room, and the sun just shines. As soon as it gets above the roof there, there's a mobile home just east of us. As soon as that sun comes up, it shines right in the doorway, and I get all the sun. And I usually sit on this. This is like a black leather Naugahyde surface stool. So I put the stool in the sun, and I, oil up with my tanning oil, and work out with my brick. It's been taking me about 16, 17 minutes to do a set. And I basically do four exercises, same exercises I was doing last year. So I push myself. I'm up to like maybe doing almost 400 reps per set. So instead of four sets, I do three sets. So three times 400 is 1200 reps. So I've been, and yesterday I did a full, like actually I did more than 1200 reps. I probably did 13 or 1400. And today I just did two sets, but I didn't do as many reps. I did about 260 and 240, so I added up to about 500 reps. So between yesterday and today, that's 1800 reps. So that's pretty close to half a pound of fat that you burn calorie wise. So, but it seems like when I work out my food, I get hungrier. So, but that's good. Yeah, I'm building muscle and I put some weight on in the last month. I put 5 pounds on, but I think it was muscle weight. Okay, anyways, it's nice. We have like these are like there's screens, okay, and then inside the screens there's these shutters like you can close, and um, and there's like so it can block the air. So I have a couple shutters open, and over there I got two over there and two over here, and I'm sitting opposite the doorway that goes toward the front and down the carport. And so I'm getting a little bit of a breeze. There's not much of a breeze through here. Actually, maybe I'll get up and open. Seems like if I open the door when there's not too much. See, this has got plastic on it, so it blocks the air. So, anyways, here we go. This sort of hang around the house, clothes. Not really dressed up that much. Anyways, when I was out here this morning working out, and you put all the oil on, and you sit in the sun. After about 30 minutes, you're all beaded up with sweat, and it's a good workout. I work out for about 15, between 15 and 20 minutes, and then I take about a 5 or 10 minute break. Then I do go for another set, 15, 20 minutes. So actually, I'm actually exercising for about an hour, and then if you add up all the three sets, and then you take a 5 minute or 10 minute break in between just to like catch up with your oxygen demand. So, anyways, it's a good workout. I enjoy it. I believe it's aerobic because you can do it constantly. It's like riding a bike. You're pedaling or swimming. You just keep going, and you're not killing yourself, but you're going at a good, steady pace. And I think it's a good workout for me. I'm a senior citizen, and I got heart failure. And actually, they did an echocardiogram on me 2 weeks, well, last Monday, right? 24th. See, today's what, 7th? No, 2 weeks ago, right. And then I had to wait a week before I went back to the doctor's office, which was last Tuesday, and he gave me the results. So they said my ejection fraction on my heart was about, they estimate 40%. So I've had higher estimates than that, but I guess it's very subjective. It's like who looks at the echocardiogram and how they figure it out. So, but I have noticed that my stamina has gone down a little bit from last year. Last year I just felt so much better, like at the end of the summer, but that was because I was working out since April. So, after 6 months of working out like 3 or 4 days a week with the brick, I was in better shape. But over the winter, I ate out a lot, and I wasn't as consistent with my diet, and I gained 20 pounds over the winter, to me at least 20, maybe 30. And so I went up. I went up at least one size. Anyway, so it's very depressing. When you're trying to lose weight and you're trying to stay under 300, and you want to get under 200, and it's just so frustrating. I mean, it's like, but if you don't keep exercising, I'm not going to throw in the towel and give up. Okay, so no, that ain't me. So I'm going to continue to do what I can. Um, I've got an appointment Wednesday to see that orthopedic surgeon again, but he gave me a cortisone shot um, 10 days ago, and he said that I could, if I wasn't in pain, I could call up and cancel just a follow-up visit. So I think I'm going to do that. I think I'm just going to call up the office and say, hey, look, I had a little bit of pain the first 24 to 48 hours, but after that, I haven't had any hip pain at all. Not like it was, it was very debilitating. Every time I got up and did a little bit, I had to go lay in bed horizontal and take the stress off my hip. But, I haven't had that problem for a week and a half now, so I'm real happy. So I think that cortisone shot did the trick for a while. I don't know how long. Hopefully, I'll be able to get on my diet better and lose weight and burn off the fat with my workout, and things will look up. The more weight you lose, the less stress you got on your joints. And I am taking collagen and in my superfood juices. I add a scoop of collagen every day. So I'm working on it. Hey, when you just have to like keep doing the best you can. That's the way I look at it. Um, so I was kind of saddened that my heart health seemed to take about a 10 or 20% nosedive from what it was before. But that just goes to show you get lazy in the wintertime and you eat junk and you don't exercise, and you know what? Can't blame anybody else but myself. So anyway. But in 2 weeks, I get to go see an endocrinologist. And anyways, I have a friend who lives in New Jersey, and actually, I visited her husband, and her son for 3 days on my way down to Florida in January. And her name's Holly. And anyways, um, Holly was so nice. See, she sent me this. This is like real stones, and she sent me this bracelet. Actually, she sent me one like a year and a half ago for Christmas, back in 2015, and it turned up missing when I was at Debbie Lynn's house. I don't know what happened to it. I kept it on all the time, but it's got leather, and I would take it off to take a shower, and I don't know. I looked everywhere for it. I couldn't find it, so I don't know what happened to my other. It's called like the Tree of Life. There's like a thing here, and you just slip this steel round thing with a tree on it. You put that through a loop. All right, so it's a very nice bracelet. It's supposed to, like, help your health and stuff. So, anyways, but I only take it off to take a shower and everything. So sometimes I forget to put it back on, but I'm wearing it now just because I wanted to show it off and thank Holly for being so nice to me. Anyways, I was in Rosie O'Kelly's hangout Saturday night, which was last night. But folks, I only had a couple of glasses of that sangria, and I get tired. And that afternoon, Babushka and I went to the saloon, and we each had, well, actually, I only had 3 pints because I had 4 cans, 4 12-ounce cans of this red ale that's made locally here in the Tampa Bay area. And it was really good. It's like a red ale. It tastes a lot like Killian's. And I really enjoyed it. And we both had cheeseburgers. I don't put a salad on my cheeseburger. I just like the raw onions and ketchup on my cheeseburger. I don't want to I like the taste of the meat. Okay? And the guy that does the cooks over at this saloon, I heard from one of the barmaids that he used to cook for Hulk Hogan. Hulk Hogan's personal chef. And you know what? This guy is good. Everything he cooks on this cantina menu is, wow, it is really good, so it's not too difficult to believe that, he was hired by a celebrity to, feed him. So, anyways, that's not too much of a stretch, is it? And I went and got my hair done at the salon Thursday. Yeah. So did a really good job. She dyed my roots and then the rest of my hair and a lighter color. So I'm not like as dark a blonde as I was. So I'm happy with the color, and anyway, I had my hair done. I had some eyebrow, I had my eyebrows waxed, and I had my nostrils waxed. If you ain't had that done yet, you should try it. It's anyways, there's nothing up my nostrils. It's like there's no hair up there. So I mean, oh well. I don't know how long it's going to take to grow back, but maybe the next time I get my hair done, maybe in a month or 2, I'll have to get my nostrils waxed again. But I get max airflow up through my schnoz, you know what I mean? So, anyways, I'm just having fun. I worked out today. Actually, I've been eating too much, and I've been eating too much at night. Like last night, I was making myself some, I have this, bread, and I cut the bread with my own bread knife. And it's like a whole wheat multigrain bread with seeds and everything. It's really good. And I got some organic, crunchy peanut butter. Put a little bit of peanut butter on one slice of bread. and I was putting these prune preserves on the other piece of bread, putting it together, having a sandwich. So I don't eat that much meat anymore. So like, uh, peanut butter's got like about 9 grams of protein or 8 grams of protein per 2 tablespoon serving, and that's a good source of protein, and it does have a lot of saturated fat in it, but it's vegetable fat. Saturated fat from a vegetable or a plant is not bad for you, okay? So people, I think that's a big bunch of bullshit. And I was telling Rosie last night, I've done a lot of research on this. Canola oil comes from a plant that is not a vegetable, okay? I don't know what it is, okay? It's like cottonseed oil, right? I mean, it's not a vegetable that you're supposed to eat. And then they process it so unbelievably, the canola oil. You know what? My mother used to eat that all the time, and I always thought it was good too, because they said it was better than soybean oil. But actually, it's more highly processed, and I don't think your body knows what to do with that oil. So, anyways, I've been reading a lot of articles on health and nutrition, and they recommend that you don't eat soybean oil because it's soybeans. Most of the soybeans in this country are harvested. They're GMO, and they get sprayed with Roundup, and all those toxins are in the soybeans or the soybean oil or whatever. So, you want to risk your life and eat that stuff, go right ahead. I don't care. But you know what? In the last year or two, I've only been getting organic extra virgin olive oil, sunflower oil, and lately I started buying this avocado oil, all organic, and flaxseed oil. So I use sometimes I'll have a tablespoon of this oil, a tablespoon of that. Like today, I made 2 green superfood juices, protein shakes, and I put a little, like a teaspoon of flaxseed oil in there, and blend it up all together and drink that. So that was like a, meal replacement. So that's what I had for lunch after I was done working out with my brick and sitting here in the sun reading the paper. So, even though I'm retired and technically disabled and unable to work full time, I keep busy. And I don't just goof off, I mean, I don't even watch TV. I have the 3 services. I got a local phone, TV, and internet. And about the only thing I use is the internet. I mean, we have a local. It's like it's like a bundle package, and I hardly ever watch the TV. Once in a while on a Sunday afternoon, like right now, I'd watch the PGA golf tournament, but I don't even know if that's on today. I saw it's like race car, NASCAR, and baseball or hockey's on. So I don't do that. And you know what? I like to get in some hangouts with some of my friends, and sometimes it's a private hangout amongst very close friends that I have. So I still go to the public hangouts. I like to socialize with certain people, and some people are very opinionated and get easily offended, and I'm not like that. Okay, maybe because I'm older, I've run into a lot of people in my working career. I've worked over 40 years, and there are some people that I worked with that were very distasteful. Didn't like them, but you know what? I maintained a working relationship with those people, and I always treated them in a professional manner. So, you don't have to love everybody equally, okay? All right. Sometimes you got to pick and choose your friends. Some friends are closer than others. Some friends really care about you more than some of their own blood family. So anyway, so I'm really enjoying living in Florida. I'm getting my sun. I'm inside this room, and I have a bush. See that? See that fruit tree right there? Yep, that blocks the view between the two mobile homes east of me. And see, you're starting to see the bush now because the bush is in shade. But the sun is so bright here. The buildings behind me are reflecting sun, and see you can't really see them that well. See, so anyways, so I have a sheltered place. It's certain a couple hours in the morning I can get direct sunlight, get a tan, work out with my brick, and I'm not like exposing myself in public outside. Now, if I stepped out on that, I think you can see it, this concrete pad out there. If I just walk out and stand on that pad, you can see down there, there's a recreation building and a shuffleboard court. And you can hear the people out there playing. So if I was to go sit out there, people down there, if they're in visual range, can see me. So, I mean, I got my sheltered little cove here and yeah, right now I can look right out to the street that we live on. But if I stay over this way, people drive by, they can't see in here because there's a shed that blocks their view. So, I have a nice little cubby here. Francis has a floor room cubicle where I can work out with my brick in the sun, get a tan, and nobody can see me. Okay, so there you go. I mean, I do have neighbors that if they open their window and look, they might be able to see something. But usually I hear them open the door, and if I'm sitting facing their way, all I got to do is rotate on that stool and face this way, and they just see my back. So, I mean, oh yeah. So, anyways, you know what? I'm having a great time here. I love it here. You know, both Babushka and I have scooters, and I think it was yesterday. Yesterday, was it yesterday? Yeah, it was Saturday. We scooted over. There's a saloon within 2 miles of here, and we go over there and have a few beers and a cheeseburger. And I was still hungry, and so I ordered a quesadilla. I usually get a quesadilla. It's like this little flat thing with two, like, tortillas, flour tortillas, and with a little bit of cheese. I mean, there was like chunks of chicken, all kinds of cheese. The quesadillas were about that high, and it was cut in fourths. And I had two at the bar, and I was going to bring like two sections, two pies. I was going to bring two home, and I says, "Hey Michelle, do you want to have one of these later?" And she said, "No, I have some soup that I'm going to make." So I said, "Okay." So I ate a third one. And I did get a little styrofoam thing and put it in there and brought that piece home. But after I got home, I got hungry, and that thing was gone, like within a few hours after we got back here. But anyways, so I know you don't see too much of me, and I haven't been putting out a lot of videos lately because I got this pain in my foot. See, I got a sock on my white bandage so that the bandage has to last like 3 days. Like they changed it on Friday, so probably Monday or Tuesday they'll come and change it again. So I got to look at my schedule. I don't think I got anything on the calendar. I think the next doctor appointment I got is on Wednesday, but I'm going to call up and cancel that. Every time I go to one of these specialists, it costs me $45, and if I'm not in pain, I think I'll pass, all these medical costs are piling up, and I still didn't get the bill for that hospitalization I had because of my foot. All right, just this foot infection is, I have to pay the first 5 days is a deductible, and I have to pay that. Even though if it's day 6, 7, and 8, they pay, well, I don't have to pay for it. My hospital bill, just the cost for going there, the cab fare and everything, it's going to total up over $2,000. Now that's unanticipated expenses. So anyways, I got to start being real frugal with how I spend my money. I'm glad I didn't get a car, because my scooter, in 3 years, that's what it's warranted for. In 3 years, that scooter will, have paid for itself, just in car insurance, savings. So, I'm real happy I got the scooter. I can get around, I can go shopping. I had a lean on the cart, and after a while my legs would get tired. But I can zip on over to the store, go up and down the aisles, put stuff in my cart, go through the checkout, and scooter home. And it's not much. It's a lot easier than even if you had a car, because you can't drive the car in the store, right? So I thought I made a great decision getting that scooter, and I love it. I mean, hey, yeah, it only goes about. You're only going like 3, 4, 5 miles an hour down the sidewalk, but I don't care. We don't have to go anywhere more than like 2 or 3 miles away. So if you're going 5 miles an hour, what's it take you? 30 minutes to get somewhere? So you just can't go as far, I mean, and you don't have to. We have parks around here. We have stores, all the stores you'd ever want to shop at, all the markets within a 3 to 5 mile radius of where we live. We everything's here. So I almost wish I had gotten one of these scooters years ago, but I just couldn't afford it. I had all these other expenses I couldn't factor in. I didn't have the extra money to buy one of these things. So anyways, I think I'm going to end this, because you know what? 28 minutes? Oh my God, I'm talking your ear off. So anyways, Fran-Sez is still crunching her brick, I'm converting some of the blubber in my arm. The muscle is coming back. See, I got guns, okay? And you know what? There's a lot of women that weight lift, okay? One of the girls that I subscribe to, her channel's called Lil Monster, Lil, all lowercase letters, LILMONSTER. And she's just a short girl. I don't know. She looks like she's like 5'1" or 2, and she's like a little Hercules girl. I mean, you should see her knock out the iron at the gym. Boy, I'll tell you what. I mean, there ain't no way I could pump iron like she does, and she's quite a good-looking gal. I'll tell you what. Wow. There wasn't any girls that looked like that when I was her age. Yeah, that's the way it is, I guess, huh? Anyways. But I'm working on my body, I like to stay fit, and you know what? In 2 weeks, when that bandage comes off and my foot's healed, I'll be down in that pool swimming. This brick exercise I do is aerobic. It's like when you swim in the water, you're pushing water back and you're going from one end of the pool to the other. Well, that's what this brick workout is, sort of like a simulation of swimming in the pool, okay? That's all it was. It was just like something I could do. I didn't have to go out and buy any weights or anything. I just used the brick, and I like it, So anyways, My dad was a brick mason, so I'm just working out like he did all day, right? So what's the difference, right? Love you all, and I'm over 30 minutes, so I ain't gonna bother. I'm not gonna belabor this. It's going on too long. But anyways, hey, look forward to seeing you. If I do have a live hangout, which I can do now because my 90-day suspension is over. Um, but I'm busy with my life. Sometimes I don't have time to do my own public hangout. But toodles.